This is really good for sciatic pain, or pain that goes down the side of your leg, to your knee, side of your lower leg, and all the way down into your ankle. And you're working the area. You can feel this bony protrusion here. This is the pelvic crest. And if you look pretty much on the highest part of the thigh, like you see how it peaks right here. If you can't see, come around this side.
See? With my fashionable pants, you can see it.
Okay. So, JJ, this is going to be good for you. Just dealing with sciatic pain. Working the glute minimus. So once again, we find where the pelvic crest is, and we kind of look for the highest part of the hip. Just find the pinkiest part. And we kind of look through here, and even if you just roll it over your fingertips, roll the muscle gently, you'll find this bony protrusion. So this bony protrusion is the greater trochanter, or otherwise, when you see like the crossbones and skull in a parrot ship. So it's that at the end of the bone, it's that bulge that sticks out, right? And it's the biggest bulge on this bone right here. It comes right out. So the glute minimus is attached to this bulge. It's like a fan, if you imagine. So this bulge is right here. It's a fan that comes out towards the pelvic crest, but it doesn't go all the way up towards the pelvic crest. It goes up maybe from the bulge to halfway. This is where it is. And the best way to get into it is with the ball mound of your feet, your toe, or your heel. So best way once again to get into it is ball mound, toe, or heel. And another trick to do here is that when this muscle is really tight, it's hard to get into it. So in this particular case, unlike with the neck, where we had to actually make the muscle tight to feel more definition, we make this muscle more lax for less definition, so we can actually access it more. So what we do is we slip our feet underneath the knee and basically just bring the leg into flexion, which flexes this area right here, and back into extension. So as it's extended, it's taut. As it's flexed, it's loose. Yeah? And you'll know how much you'll have to give based on how taut this area is. So once again, with my feet, I explore the bony regions, and I'll find gently rolling over to find that ball, that bony ball. And then, once I know where it is, I just come right off of it and just start pressing. And as I'm pressing, like if I go up here, kind of tell, slowly strumming. Not pressing too hard, like I'll give her a lot of pressure in a specific area, but I want strum. I'll let off a little bit so that it doesn't hurt her when I do strum. When I find that another tense fiber, I'll press in. Use my hands to support me. And once again, as much as I can, trying to move from the belly itself. Just hold on. And so if you're not supporting yourself with your hands, here, it's going to be harder for you to push with your foot. So you're actually going to have to make more effort to lean forward. How's that feeling?
Oh, it's intense in some spots. No, but it's good because I like deep work, so it's very good.
So no one else was thinking Lauren Hill when he was saying strumming with.
I was wondering why your face was
with his heel. So I'm still laughing to myself.
So So once I'm done with the massage, I let my foot out from underneath and I ask her to cross your legs with this foot staying on the mat. So go ahead and cross your legs. So she crosses her legs and I just adjust by bringing it up like this. So now I put one foot on the lower leg, one foot just above the knee. And I position myself where it's comfortable. And then I hold on to this leg and push these two. Now, I've gone to pretty much my limit here, so I'll just bring my foot up and push some more. And this stretches the glute minimus. So once again, I'm running out of pressing area, so I'll just let off a little bit and scoot my butt closer. Remember, take your time. You know, you're going to be working with other people doing this. Be comfortable. Take your time. Adjust your body so it feels good.
And so you're making sure your feet are kind of equally around that knee.
Yeah. And like right now I'm more so stabilizing, because once I got to this far, you know, I'm mostly stabilizing with this foot and just slightly pushing. You know, I mean, it's always better to not stress the knee joint, you know, like right now, just coming, you know, once she's already in so much stretch, it's okay.
It feels really nice.
But you may be stretching somebody out that won't have this much range, you know, so don't think you need to really, like, I saw a Roman pushing, you know, her leg all the way out. Like, if you come to an end point, just let that be.